Everyone, I'm Himanshu. I'm a gynecologist and IVF specialist working in London. Welcome to our YouTube channel. I hope you have all been well. And this is our latest addition to the channel. I hope you are enjoying the channel. If you have any particular topics you like to be covered, please put in comment section and we will try and do it as soon as possible. So March is an endometriosis awareness month. So this is about raising awareness, breaking myths, and supporting women. So what is an endometriosis? So it's a chronic, often painful condition where a tissue similar to the lining of the uterus grows outside the uterus, affecting almost 190 million women across the globe. So the global picture is quite difficult. It almost affects 10% women of reproductive age group and potentially almost 50% of women suffering from subfertility. And it is found to be a major cause of infertility as well as pelvic pain. If you look at India, estimated 42 million women are affected, and unfortunately, the condition often goes underdiagnosed and shamefully stigmatized in majority of the cases. There are certain myths about this condition that it can only affect the pelvic region. Unfortunately, that's not true. Endometriosis has been seen not just pelvis but outside as well, in the caesarean scars, in umbilicus, in the rare occasions in lungs as well as brain. The other myth is that severe pain is normal during periods. That is not true. Yes, periods are uncomfortable and can be so in certain group of women, but if the pain is consistently for more than 6 to 8 periods, that's not a normal sign and one should seek specialist help. The other myth is that pregnancy cures endometriosis. That's not true either. Yes, pregnancy sometimes helps to elevate the symptoms, but that doesn't mean that it stops the progression of the disease. And similarly, another popular myth is that endometriosis always causes infertility. So that's not true either, because we are unable to scope and scan every woman. We don't know the true extent of the disease. However, in my opinion or in my experience in these years, 50% of women suffering from subfertility do have endometriosis. So yes, it is a contributory cause for subfertility, but definitely not in all cases it will lead to subfertility. The challenges in the diagnosis are average delay is almost 7 to 10 years, which is again quite awful because these women are suffering for all these years, and if they are of childbearing age, that has a negative impact on their fertility success. The symptoms are often dismissed or normalized, which is again not very nice for these patients, because people would say you always have pain during your periods, or that's quite okay and you can just take painkillers. But unfortunately, that's not true. So if your periods are painful, you need to seek specialist help. And obviously, there is a massive lack of awareness, lack of education amongst general public as well as medical professionals, which adds to the insult. Current diagnostic methods, they include history taking, clinical evaluation and examination, as well as symptom tracking. We also perform transvaginal and pelvic ultrasound to look at the uterus, ovaries, any cysts, any adhesions, any scarring, which could be suggestive of endometriosis. In certain cases of deep infiltrating endometriosis, MRI is very helpful. Laparoscopy is considered gold standard because endometriosis is a visual diagnosis, and sometimes we will end up taking biopsies from the tissue for histological diagnosis. The current treatments, we manage pain with painkillers. There are hormone therapies available, such as combined pills, progestogens in various forms, such as mini pills, are injection Depo-Provera, an implant, or a Mirena coil. Sometimes GnRH analogs are used, and recently you must have heard in the news that a new tablet called Ryco has been approved by the NHS to be used in these patients. In certain cases, a laparoscopic surgery is essential, and obviously, if the patient is suffering from subfertility, then fertility treatments are needed in certain patients. The future for diagnosis as well as treatment is AI based symptom tracking, non invasive biomarkers in blood or saliva, improved imaging algorithms using AI, and personalized treatments using genomics. However, majority of these treatments are still experimental and have not been undergone clinical trials to be used widely. How the Nari app helps. So recently you must have heard that we launched an app called Nari. It is to help women in all aspects of their health. So Nari allows you to track menstrual cycle as well as symptoms. We have integrated AI, which will detect the patterns which could be suggestive of endometriosis, and it will send you notifications. It also helps users seek timely medical advice. It supports in early diagnosis and ongoing management. And we further want to enhance the use of AI to predictive insights so that we can improve after we collect a better patient data. Together, let's break the silence around endometriosis. So please download the NARI app and join the change. Thank you.